So welcome everyone. Thanks for coming to this session. I'm Corinna Franklin. I'm the Director of Sports Medicine at Shriners in Philadelphia. And with me are Christin, Ali, and Courtney, our sports PTs extraordinaire who are going to talk to you as well. I'm going to share my screen here. I'm going to talk to you guys about common sports injuries that I see in athletes. And then these guys are going to talk about how to prevent some of them. So again, I'm the Director of Sports Medicine. I'm also an orthopedic surgeon, so there's obviously going to be an orthopedic bent to this. Oh, I don't need those, sorry. Let me try that one more time. So I think one big question that people have often is, when do kids need surgery? Or when can something just be watched, or when can it be treated conservatively? So I will just preface this by saying, as a surgeon, this may represent some of my own inherent bias, right? I prefer to be involved in the decision-making, and some chronic injuries are more challenging. So they may make surgery more challenging and rehab more challenging. So if there's one thing to take away from this talk, it's that I prefer to know about something earlier rather than later. So just because something doesn't obviously need surgery doesn't mean I don't want to see it. I'm happy to see simple basic injuries as well and help direct that rehab process. That being said, oh, hang on, some people in the. That being said, there are some injuries that really favor early operative management, and particularly shoulder dislocations, ACL injuries, even if very young patients. And for both of those, it's because of the risk of continuing to play in an unstable joint. So I'll talk first about acute injuries. We'll just start at the top and go down. So we can talk about the shoulder. Different things that happen in the shoulder included true dislocation or an AC joint separation, which is a shoulder separation. People our age and older may have tendon ruptures and rotator cuff tears, but those are actually very unusual in young athletes. So a shoulder dislocation is most commonly anterior, meaning forward. So when for example, when a player has their arm cocked backwards like this, and they get clipped in the elbow, then the shoulder goes out the front. It's very important to do a careful nerve exam. So for us, or for your trainers, when you see these patients, it's important to make sure that their nerves are working. And then we really want to get it back in the socket right away. Unfortunately, for young players, age is the most common factor in recurrence. So there's a couple studies that show that in young patients, the recurrence is almost 100%. You can see here an MRI image that just has the kind of classic shoulder dislocation lesion, which is tearing off the anterior part of the labrum. So this is a slice kind of straight through the shoulder. If you can see, this is the front, this is the back, and this labrum is torn here. So for these injuries, we've really kind of moved towards talking about surgery right away, because for young patients, particularly people who are going to continue to be in high contact sports or going to put a lot of weight through their shoulder, so let's say gymnasts or cheerleaders, people generally find it unsatisfying if you say, okay, I'm going to take your level 8 gymnast out of her sport for 8 months, 3 months, have her do all this rehab, really tune her up. But then as soon as she really tries to land a complex flip, or as soon as your star quarterback takes a bad hit, it's just going to come right out again. Parents don't usually like that, and it's not satisfying for any of us to manage things that way. And so there's pretty good evidence that these do better if you fix them the first time. That can be hard to hear for parents who may have a very young athlete and are not excited about the idea of surgery, but it's at least something we need to discuss. So then the shoulder separation, it's not really the shoulder joint, it's the acromioclavicular joint, it's the joint in the front of the shoulder area. But this is basically what it looks like. So this joint gets disrupted and the clavicle comes up. In serious separations, you can actually see the clavicle kind of poking upwards. For these, it really depends on how dislocated it is. So if it's all the way up here, like in this x-ray, then those will typically fix. If it's just kind of in the middle, then we don't. So now I'll talk a little bit about the knee. There's a lot of different things that can go wrong in the knee. So you can tear your ACL, you can dislocate your patella, and you can tear or sprain any one of the other ligaments in your knee, or you can tear your meniscus. So acute knee injuries, they can be contact or non-contact, right? So I think a lot of times we think of this picture here when someone's helmet clocks into the knee, or if you're playing soccer, someone else's knee clocks into your knee around a planted foot, and you take a bad hit and tear things up. But actually quite a lot of these can be non-contact injuries. In particular, girls or young women can tear their ACL just from turning around a ball or from trying to dodge another player. The athlete may feel a pop, the knee may swell up, and actually when the knee swells can be a clue as to what is torn. So if it swells up right away, it's more likely an ACL. If it swells up later on, it's more likely a meniscus. They may describe feelings of giving out, although actually that can describe a lot of different injuries. And then the direction they were hit or the direction that their body went can suggest which structures are injured. ACL injuries are unfortunately increasingly common, again, particularly in girls. Girls have between 2 and 8 times the rate of ACL injuries for the same sport as boys. Patellar dislocations are also common, and these are super common in female athletes. So in general, I think one could have a really low threshold to refer patients to see us because, again, I prefer to know from the beginning, and the risk of trying to rehab or continuing to play in a seriously injured knee is high. The best thing that could happen would be someone comes to see me or one of our therapists and we say, actually your knee's fine. You just sprained it a little. You just need a week or two and you'll be back. I'd much rather have that than have somebody have a serious injury, not recognize it, try to play on it for a couple more weeks, tear up the rest of their cartilage and then come. That makes it much harder for everybody. So in terms of ankle injuries, I left a lot of these medical terms on here and I'll explain what they all mean. So a lot of times we're trying to decide, okay, someone had a bad ankle injury, it's super swollen. Is it a sprain or is it broken? Times when we are more suspicious for something being broken is if the athlete is tender over their bony prominences. So if they're malleoli, which are those bumps right on the sides of your ankle, or if they can't bear weight. So if they can't stand to put their foot down and bear weight on it, then we definitely need an X-ray. Most ankle sprains, fortunately, are low, meaning that kind of down right in the ankle joint itself and respond well to non-operative treatment. We do actually recommend PT for athletes who have ankle sprains because even though they're relatively mild, they can cause a lot of difficulty, especially if people keep having ankle sprains. And so it's pretty important to have an athlete work on their balance, their proprioception, and then the muscles that cross the ankle to try to support that ankle and keep it from happening again. You can have what's called high ankle sprains, and that's when the force of the injury goes all the way up the ankle ligaments and tears them, in which case you may actually need surgery for that. So those are sort of the acute injuries. We can move to chronic injuries next. So these again, we'll start again in the shoulder. So the things that tend to happen for throwing athletes are impingement, slap lesions, and little leaguer shoulders. So impingement is basically just when your rotator cuff tendon gets caught between your shoulder joint and your humeral head. Basically, it's in that same place when your arm is cocked all the way back that can really bring the tendon up and cause it to rump underneath. And it's really associated with an internal rotation deficit, which is something that's seen even in young pitchers. So one thing that we do look carefully for is for people who are throwing a lot is whether they have an internal rotation deficit. So whether their throwing arm can't rotate down and in as much as their non-throwing arm. And it may seem unimportant, but it actually really predisposes athletes to injury in their throwing shoulders. So this stretch that you see here at the bottom called a sleeper stretch is one of the things that we do to try to help get that stretched out and restore their range of motion so they don't get injuries, in addition to strengthening all the musculature around the shoulder. So then I think we hear about slap lesions a lot. It stands for superior labrum anterior to posterior. It's basically just the kind of cuff of tissue, not the rotator cuff, but the lining of the joint, the part that keeps the joint stable at the top of the shoulder, right under the biceps tendon. That can also get torn with repetitive motion, particularly if you have that internal rotation deficit. This happens in throwers, but also anyone who's got a lot of overhead activities. So again, weightlifters, gymnasts, divers, tennis players. Patients often have kind of vague pain, but there's this classic test here at the bottom that can help distinguish it. And for a slap lesion, we really start with PT, although if that doesn't help, they may eventually progress to surgery, particularly if the shoulder is unstable. Then for basically every joint in the arm, there's a little leaguer's condition of that joint. It basically just means that if a young pitcher is throwing a lot, the growth plate or the plate from which the bone grows can't sustain that stress. And so unfortunately, the time when you're growing the most is also typically the time when it becomes clear who's going to be a really good pitcher. And so that's when young pitchers often gets, they're on multiple teams, they're throwing all the time, they're throwing harder and harder, but before they really have the same level of control that say a 20-year-old pitcher would have. And so the growth plate is actually a weak part of the bone, and it can get injured from all these forces going across it. Athletes will typically have shoulder pain, tenderness around the shoulder, and they actually will start having weakness, and then their velocity will start to decrease. So this fortunately doesn't need surgery, but unfortunately it does need a period of rest, and then definitely PT to strengthen the shoulder after that. In the knee, a lot of things can happen chronically in the knee. So you can have tendonitis, or you can have what's called apophysitis. So in a growing athlete, a lot of places that tendons attach is where there's a growth plate. And so all these arrows are pointing to different places where you have a strong tendon that's attached to a growth plate. So they're all kind of long eponyms that make things sound worse than they are. It's really just like an irritation of the tendon attachment. So the one at the bottom of your patella is also called jumper's knee. The one at your tibial tubercle or right below your patellar tendon is called Osgood-Schlatter, and then you can have it in your heel and it's called Sever's disease. You can also, of course, have patellar tendonitis or Achilles tendonitis just from overuse of those tendons. And again, kind of like with little league or shoulder, as kids get better and better, and they also practice harder and harder, and sometimes their desire to play or the hours that they play kind of outpace the growing body's ability to sustain that kind of repetitive stress, because again, the growth plate is sort of a weak point, and over pulling on it can cause pain. These almost never progress to surgery, but they do require a period of rest to get better. And then there's something called patellofemoral pain, which is kind of a broad category, but it really describes pain that you feel in the front of your knee. That's typically worse when you're going up and down stairs or squatting. This is more common in girls. And it's also pretty common if you go back to activity, particularly running, after being inactive for a while. So I think probably we're seeing a lot of this in a huge age range right now as people start to come back to sports after a period of inactivity. Typically, this is also as a result of a little bit of quad weakness, particularly the inner quad, and then also the hip muscles. And so this is super treatable with physical therapy, but it does require kind of dedication to your physical therapy course to get better. And then you can also have what's called OCD lesions, which is basically a little bit of a small circle of damage to the cartilage in the knee that starts again from repetitive microtrauma, just like kind of some of the other things we've talking about. And so this typically presents with pain, kind of diffuse pain and swelling, and then treatment sort of depends on what the lesion looks like, but this could potentially go to surgery. I'm going to skip over cysts, but I will talk about shin splints because I think this is pretty common. So I think we all think of these as happening mostly in runners, but actually lots of athletes can have them, certainly soccer players or anyone else who does a lot of running. So this again almost never progresses to surgery. One of the most important things is to have the right shoes. This can be associated with the female athlete triad when young women aren't getting enough nutrition, and which can also happen pretty frequently in distance runners. Finally, sort of the final common pathway of repetitive stress is a stress fracture. So that's when, again, the bone itself can't tolerate the repetitive stress. This typically comes from high impact athletes, runners, ballet dancers, and things like that. Stress fractures actually can progress to surgery, to requiring surgery, depending on where in the body they're located. And to some degree, the sport the athlete plays. We almost always check a vitamin D, but these can be kind of difficult injuries to get through. And so I know there was a lot of information, but just to kind of sum up, things that probably will need surgery are shoulder dislocations or severe AC joint separations, knee ligament injuries, in particular a patellar dislocation or an ACL injury, fractures or OCD lesions. And then things where you can typically pretty safely start with PT will be tendonitis, apophysitis, patellofemoral pain, ankle sprains, and internal impingement in the shoulder. Though again, I would say in general, something does not have to be surgical for me to see it. Again, we really prefer to take care of the whole athlete from the beginning. And so if there's ever any question, or if you guys don't know, if you have someone you want us to evaluate, please feel free to have them just come to us in sports clinic, or also you can shoot any of us an email. We can talk through, whether someone needs to be seen or what we think the right course of action is. And we do have sports clinic every Friday afternoon, so it's pretty easy to get to us. That's my email address in case anyone has any questions. And then I will stop screen sharing and move on to our PTs.
Okay, just give me 1 second to pull up our presentation. Dr. Franklin, can you enable screen sharing?
Should be, but let me see. I might have to make you the host. Try now.
Okay. Can everybody see that okay? So Courtney, Ali, and I are going to talk about how you can prevent some of these injuries and some things that we'd like to share potentially in the future. As Pat had mentioned early in the presentation, that we are open to coming out and working with you, coaches, parents, athletes, on a team-by-team basis and teaching you some things if at all interested. So just going over sports injuries, as more and more children become involved with organized sports, that means more children are getting injured each year. And just about 1/3 of all childhood injuries are sports related. I'm just going to go.
I think the PowerPoint's not up.
Yeah, Kristen, I can't see your screen.
There you
go.
There you
go. Sorry about that. So as I was mentioning, as more children get involved with sports, there are more injuries each year, and almost 1/3 of all injuries incurred in childhood are sports related. And we're just going to go over some of the most common injuries, which are sprains and strains primarily. But when you look and break it down into males and females, the 3 most common sports for males is ice hockey, football, and wrestling, and then females, gymnastics and basketball. We've all seen it in a wide variety of sports. As far as the orthopedic injuries that occur, primarily sprains and strains, and then fractures, and specifically growth plates in the pediatric population. As far as rating the sports, primarily basketball, followed by football, baseball, softball, soccer, and hockey. And then as far as prevalence in age, most of our middle schoolers are the ones that are getting injured. And you can think about the fact that they're going through puberty and big growth spurts, and as well as becoming a little bit more aggressive in their sport at that age, followed by elementary school children and then high school children. So why are our athletes getting hurt? As I first mentioned, skeletal and muscular immaturity. Open growth plates lead to some additional types of fractures that you don't see in the adult or in the adult population. Training and competing at earlier ages. Children are getting involved in youth sports younger and younger, and then adding to that the increased intensity that they're seeing at younger ages. Sometimes their training is inadequate. They're not getting a full gamut of strength and conditioning, stretching, plyometric, speed and agility type of training. Oftentimes they're they're getting involved in a single sport very early, and sports specialization is something else we'll talk about. A lot of times now there is no off season for them. They might be involved in the same sport year round, even though there is a primary season for that sport. They may continue to play different times throughout the year. And then there is no off-season strength training or even in-season strength training just to maintain any type of gains they may have made over the course of the year. And poor nutrition, unfortunately, is another reason why our athletes are getting hurt. And we'll talk a little bit more about different ways that you can look at your nutritional plate based off of the amount of activity. So early sports specialization, we define it as training greater than 8 months out of the year in a single sport, and you're excluding all other sports. And this oftentimes leads to overuse injury, which is a chronic injury related to repeated stress on the muscle system and not having enough time to recover from that stress. And it's interesting, there was a survey that was completed in the past where showed that parents were the strongest influencers to start a sport and get involved in a specific sport, while coaches were the ones who were the biggest influencers to intensify their training. And what are some of the effects of early sports specialization? You have the physical risk of higher training volumes might cause some type of physical injury, but also the psychological risk that it might contribute to burnout or dropping out of a sport earlier than anticipated because they're just tired of it. They're tired of the pressure, which may be coming from themselves, from their teammates, from coaches, parents. It's a wide variety. So what is a parent or a coach or an athlete to do? Because we recognize that some degree of specialization is going to be necessary to attain the higher skill level. But we have to remember that intense training in a single sport to the exclusion of others should be delayed, at least until middle to late adolescence, to optimize success, to minimize the risk for injury and the psychological stress. So a lot of times we'll mention during our clinic frequently about the number of hours of training per week should not exceed the child's age. So for example, if your child's 7 years old, they should not have more than 7 hours per week of structured sports. And that's inclusive of every league they might be playing in, whether it's rec plus as well as games and practices. But you want to keep them open to unstructured play, getting out and riding bikes, summertime swimming, things like that to keep them moving. So what do we need to do? We need to find a good balance because we know that more training is going to enhance their performance by allowing the body to physiologically and physically adapt. But training causes stress, but there are good stressors to build muscle and things like that. But then too much stress causes fatigue. And too much fatigue, your athlete is not able to perform at the high level that they're capable of performing. The other thing that we need to make sure is our athletes are getting an adequate amount of recovery, which doesn't happen frequently enough.
But we don't need them.
Okay.
They should be getting 8 to 10 hours of sleep per night.
No, I'm watching. I'm like, please. I'm like, you're like, it's fine. Like I'm gagged to mouth. You're gagged.
Can somebody please mute their phone?
No.
Why?
Because
Or
I'm like,
computer?
trust me. Just go shower, please.
Okay.
Sorry, somebody needs to mute their computer or phone. Thank you. You want to make sure that your athlete is eating enough, especially protein and carbs. And we need to ensure that they are getting 1 full day of rest per week. And I know this is even hard in our house, and we really try to enforce it because the body does need recovery. And so how do we improve our capacity to handle this load, or the athlete? How can they improve this ability? So they definitely learn tasks by doing skills and drills, and a lot of that is completed during practices, camps, clinics, things like that. But once the technique is developed, they're not going to get any better at that technique until they develop more strength and power. And so players need the flexibility, strength, agility, endurance, balance, and moving forward, I'm going to advance to the next slide where Courtney is going to take over and talk a little bit about youth strength training.
Right, so why is strength training important? So strength training reduces the risk of injury by improving the body's capacity to handle a load. So it allows our body to handle stresses. This is more important even post-injury because we have an injury because our ability to handle this load is decreased. Next. So the old school thinking of strength training is that we're going to be damaging our growing skeletons of our kids. New school is that this is a very important component. That strength training is a very important component. And it is safe and effective when we follow appropriate guidelines. Next. A lot of studies have shown that strength training can reduce risk of sports-related injuries when it is appropriately prescribed and well supervised. Next. So we don't always have to train a single task to improve the single task. For example, if you want to increase your running speed, you don't necessarily, the best practice isn't to just practice running really fast. It's important to work on all the components that will help us run faster, which are strength training. Next. So proper technique is key when strength training. We don't just give our athletes a quick home exercise program and say, go ahead, lift 50 pounds. It's important to attain proper technique first, and then gradually increase resistance. Our prescription for strength training is 2 to 3 days a week on non-consecutive days, so an every other day schedule. When athletes are in season, we tend to give them a maintenance program to maintain their strength, and then off season, we build strength and build power. Next. So there's a few injury prevention programs that I wanted to talk about. Typically, they are 10 to 20 minutes, and you complete them before games. And there are the two we're going to talk about are PEP program and the FIFA program. And overall, both the programs are pretty similar, and their main components are to improve safe body mechanics and proper strength and plyometric training and prep the body for a game. Next. So the PEP program, which is out of Santa Monica, consists of there's 5 components. There's the warm-up, strengthening, so lunges, squats, etc. Plyometric component, which is jumping and pivoting, and an agility component and stretching. Again, all to prep the body for play. Next. Thanks. So the FIFA 11 injury prevention program is another program which can prep the kids prior to their practices or games. This has been studied a lot as well. A recent study came out that showed that this gradually, oh, sorry, I lost my place here. That this will gradually reduce ACL injuries. And that overall they had 30 to 50% less injuries than groups that did not perform this program. Next. So there are 3 components of this as well. So part 1 is running, 2 is strength, plyometrics, and balance, and 3 is running. And there's 2 different versions. Next. So there's a kids version, and all this can be found on the FIFA 11 website. It has a pretty detailed description of all of these activities. Next. And then this is the older kids version. Next. So this is kind of how you would set up the fields to do the FIFA program. So you can see you don't really need a lot of equipment. Go ahead, next. And also the interesting thing about this program is too, it shows the website goes through all different positioning components and compensations so that you can make sure your athletes are having good form while they do this program. Next. So again, here's another example. A plank is part of the one of the components. So the website will show you different pictures like of the wrong ways to do it and the right way. So for us, one of our main recommendations are always hip strengthening and core strengthening. That really keeps these are kind of underutilized or under exercise muscles. And so these are some of our like top exercises that we prescribe our patients for injury prevention. We also have, next. We also have a comprehensive home exercise program. And here's just some of the examples of it. So this is focusing on core, hip, hamstring strengthening, as well as plyometric and agility. So here's just a few examples of the exercises. Next. And then you can find the link down here has the whole video on our Shriners YouTube of this home exercise program.
So I'm going to end the presentation talking a little bit about just proper fueling. Dr. Franklin mentioned a little bit earlier about the FEMA triad. And so basically, if we're not giving our body enough fuel or enough food and water and hydration, then we're not going to be able to compete and perform at the level that we would ideally like to. Next, please. So I know, back in the day, they used to do the plates for your vegetables and all that. And so now we are able to kind of dive a little bit deeper at training and looking at like type of athletes and kind of the fuel that they need. So for example, this would be an example of a plate for like an easy training day. So you see here, there's a lot more fruits and vegetables. You've got some lean protein and then a little bit of whole grains. Next. For a moderate training day, this is where you train, you might be one where you train twice, or you might be focusing on a technical skill in a workout and you need a little bit more fuel. You're looking at a little bit more grains and lean protein in this situation, but you're still getting a lot of vegetables in. And the moderate day should be your baseline from where you adjust. So this should kind of be like your staple. And then if you have an easier day or a day where you're not working out, you might go to the easy plate that I just showed you, or I'll show you next kind of example of a hard training day. Next, please. So when we think about hard training, you're thinking about maybe game days, or if you have an athlete who's a runner and they're doing a long run, something that you need that fuel to kind of make sure that your body can get through those intense training days. So this is a plate that you would load up in the days before. So for example, if you're going on like doing like a half marathon or 5K or something like that. And then also even after event. So for example, I know there's some soccer athletes, I think on this call, if you did like, let's say a tournament and you played all weekend, you want to fuel your body after the tournament as well. And so with this example, you're having a lot more grains on the harder training days. Next. And then this is just some kind of tips that the Olympic division put out. A lot of basic stuff, but it's just kind of a good reminder. So to stay hydrated, you want to make sure you fuel up, boost your immune system, limit your fats, eat to recover, and then make sure they're just recommending sport products like bars and gels and stuff. And that's one of the big things I find, a lot of us here on this team were athletes and still are athletes, and just making sure that you're also fueling your body before and after these competitions is very important. Next. This is kind of touching base on breakfast. So I know a lot of high school, middle school athletes, they run out the door before eating breakfast, and just as kind of a big reminder to eat your breakfast, because that is really the most important of the day, and we can get a lot of fuel through that option. And just some options If we're kind of limited on trying to figure out what we can eat, for example, we can do some whole grain cereal, waffles, oatmeal, eggs, smoothies, etc. Next. It is important to read the food labels, excuse me. One of the things that you kind of we recommend looking out for are saturated and trans fats increase inflammation and slow recovery. So make sure you try and limit or decrease those things altogether when looking at your food labels. And then when we're looking at percent daily value, that doesn't pertain to the elite athlete. So don't go by that 2,000 calorie a day, especially if you're a higher level athlete. Next. And then here's just some more kind of tips or pearls. So we want to eat a diet that's eating a diet in higher saturated trans fat and promote inflammation, like we talked about earlier. Sodium promotes better hydration before, during, and after training or competition. So endurance athletes might require some more sodium than non-endurance athletes. But obviously we don't want too much because that can also have a negative impact. You want to make sure that you're eating your protein and then making sure that you're getting your vitamins and minerals as well. Next. And then just some 10 tips to keep our young athletes on the field and off the sidelines. You want to make sure we're understanding our body, which we did a little bit about today and during this presentation. We want to eat enough and eat well, make sure that we stay hydrated. We want to warm up and cool down. For example, like when we talked about the PEP program or the FIFA 11, we want to make sure that we're doing body strength and conditioning. We want to make sure that we have proper form, which when lifting, which is very important to prevent injuries. Mental health is also important as well. And so making sure that you have someone to talk to and you don't feel pressured into doing sports, getting proper rest, and then just staying confident and having fun. Next. Here are some good here are some good options and things to look up about nutrition and different youth athlete programs if you guys are looking for more information. Next. And then we are also looking for volunteers. Dr. Franklin is doing this amazing study at Shriners, and we are looking for just youth athletes, preferably non-injured, if that is correct, Dr. Franklin. So if anyone's interested.
Yes, sorry, uninjured. Our current study is on uninjured athletes. We're curious about how athletes who are healthy perform on the tests that we use to evaluate injured athletes or athletes who are coming back. So we're really interested in a range of ages, of sports, boys and girls. So yeah, just let us know. We would love to have everybody. It's actually pretty interesting and fun. The kids typically enjoy doing it. It takes about an hour and a half per athlete.
And this is our contact information. Like Dr. Franklin mentioned earlier, we have our sports clinic every Friday afternoon. So if you're interested and want to be seen, you can come and call and make an appointment to see us in our sports clinic. And then we also have fracture clinic every day if you have an acute injury. So you can give us a call or go online. Now we can answer any questions if anyone has anything specific for any of us.
While everybody's thinking about that, ladies, thank you very much for stepping through all of that information. There definitely is a lot there. Dr. Franklin, thanks for starting with what we're hoping to prevent, and that is all the bad things that might happen if we're not able to take advantage of some of the preventative stuff that was shared here. Our organization hosts a number of different sports. I think, Christin, you may know best, but you know, from baseball to softball, field hockey for the girls, basketball, soccer, and the soccer teams are just starting to get formed and getting ready to go. So I think there's going to be a lot of really good opportunity to take some of the references that you provided us here and make sure our coaches have that, make sure that they're thinking about allocating the right amount of time and taking opportunity to share with their families and with their athletes. And so I just want to say thank you on behalf of WRA for again, being willing to share this information and being willing and open to us reaching out and asking for some additional help. You know, we share the same common theme, and that is, you know, we're trying to make sure the kids enjoy playing sports and they do it without having to go through the rehabilitation of injuries and things like this. So So again, thank you very much on behalf of WRA. I guess now that that I got that out of the way, are there any questions? Anybody who's able to join us tonight? Do you have any questions for Dr. Franklin or the sports injury staff? All right.
Well, thank you very much for your time and attention. I will try to convert this into a format that can be sent out, and I'll send it to Christin so that you guys can have it. And again, if you're interested in learning some of the programs that these ladies talked about, or would like help in kind of lifting form or anything like that, we're definitely happy to come out as a group and kind of go through this in person with your coaches and athletes if you'd like.
Yep. Dr. Franklin, we will definitely take that back. We have we have probably 150 to 200 volunteers that, all from different walks of life who want the best thing for their kid. And sometimes they don't know what they don't know. And so if we can give them some of these tools, and if you're willing to maybe even show us at some point later in the summer, I think you often get a whole lot more out of that interaction than maybe just watching a YouTube video. Those are very helpful as well, but it's always good to talk through, what you see and how best to do it. So I very much appreciate, Shriners Hospital supporting us, to you guys again for coming tonight to support us. And we'll make sure that we get this posted to the rest of the organization. There's several soccer committee members that I see on the phone that can help disseminate the information down to all of our families and volunteers. So thank you again.
Thanks very much.
Thank you. Good night, everybody.